Hello, everyone. I'm Dr. Angela Mattke, and welcome to Ask the Mayo Mom on Mayo Clinic Q&A. I'm a pediatrician at Mayo Clinic Children's Center in Rochester, Minnesota, and host of this show about pediatric health topics. Today, we are once again discussing COVID-19, and the U.S. has now entered its fourth surge due to the Delta variant spread. Children across the U.S. are returning to school during this same time, and this has created many questions for families, including my own, that we plan to address today. We have three guests joining us. Our first guest, Dr. Nipunie Rajapakse, is a pediatric infectious disease physician at Mayo Clinic Children's Center. Our next guest, Dr. Emily Levy, is a dual certified pediatric critical care and pediatric infectious disease physician at Mayo Clinic Children's Center. She also represents pediatrics on the Mayo Clinic Infection Control and Prevention Committee. Our last guest is Dr. Chad Schroeder. He is the principal at Washington Elementary School in Rochester Public School District. Mr. Schroeder brings a wealth of experience as he enters his 24th year in education, 16th year in administration, and 8th year at Washington Elementary. And we are excited he can join us today to share his wealth of knowledge, helping children prepare for the school year. Remember, if you're listening live, please send in questions and we will try our best to review them during the live broadcast. Mr. Schroeder, thank you so much for joining us today. I know this is a pretty busy time of year for you with the return of students upcoming.
Yeah, thanks for having me. I appreciate it.
Absolutely. And Dr. Rajapakse, Dr. Levy, thanks for joining us again.
Thanks for having me back.
Happy Dr. Rajapakse, thank you, Emily, or Dr. Levy. Dr. Rajapakse, there has been a lot of changes with COVID-19 since we last talked. What is the current situation with the number of COVID-19 cases currently in children in the United States?
Thanks, Dr. Mattke. So that's a great question, because since we last met, as you mentioned, there's been many changes that have happened. Obviously, we've had rollout of vaccination, but I would say currently the biggest issue that we're facing is circulation of the Delta variant of COVID-19. So this variant is now making up more than 90 to 95% of cases within the country. And this has led to a few different challenges. When we look at the pediatric population, we are seeing right now some of the highest numbers of hospitalizations across the country, but primarily in the southern part of the country, higher than we have seen at other points during this pandemic. So it's certainly very concerning. We're seeing in general higher hospitalization rates amongst people under 50 as well. And that was based on some recently released CDC data. Some areas in the South have been reporting running out of intensive care unit beds, both adult and pediatric, and needing to transfer patients outside of their state because they're running out of capacity to provide care. So really a crisis situation in many areas right now. As of August 12th of this year, there's been just over 4.4 million children who have tested positive for COVID-19 during the pandemic. In the prior week, there was 121,000 new cases. So these are really high numbers. We had seen kind of until June rates seeming to come down quite nicely. And then from July onwards, we've seen an increase. We've also seen ongoing reports of cases of multisystem inflammatory syndrome in children. This is a rare complication, but can be serious and life-threatening after a child has had COVID-19 infection. And currently there is just over 4,400 cases that have been reported in the United States, and unfortunately around 37 deaths of children from that syndrome as well. Adding kind of additional challenges on top of COVID-19 is the fact that we're seeing circulation of other respiratory viruses in the communities now, kind of at an unusual time. So one example is a virus called RSV, or respiratory syncytial virus, that really causes most issues for kids under a year of age, elderly patients and immunocompromised patients. And usually we see it circulate in the wintertime, but this year we've seen increased cases over the summer. And so that's adding some additional stress, because some of these children end up needing to be admitted to hospital and ICU as well. So definitely a really concerning time in the pandemic, especially for our pediatric age groups. And we'll talk a bit more about Delta variant and why we're seeing some of these trends as well, I think, later on.
Yeah, that's a great segue. My question for you, and I think I'm hearing it from a lot of families, is do we know if the Delta variant is causing more severe infections in children, in teens, or is it just that we're starting to see more infections in kids because many of this population aren't able to be vaccinated?
So right now, there's no vaccine that's been authorized for use in our kids under 12 years of age. So certainly that is contributing. They have not benefited from the personal protection that getting a vaccine gives you. What we know about Delta for sure is that it is more contagious than the prior variants that we've seen, about 2 times more contagious. And so it's spread much more easily from person to person. There have been some studies that have suggested that you might have a higher likelihood of being admitted to hospital if you get infected with Delta variant, but we are still waiting for kind of more definitive information on that. Because we're seeing such high numbers of people admitted, people infected, especially kids, proportionally that results in more people winding up in hospital. And so it's a little bit challenging to tease out just the significant increase in numbers of people getting infected and how that relates to how many people are landing in hospital, but definitely something that people are working to understand better. We are still seeing that most infections with this variant are occurring in unvaccinated people, and they continue to be at much higher risk for ending up in hospital or with more severe illness. So really everyone over 12 years of age, we're strongly encouraging to go out and get vaccinated, because that is really going to give you your best protection from ending up in hospital with this infection. We have also been learning that breakthrough infections, so people who have gotten vaccinated, are possible. Most of these people will have either asymptomatic or mild symptoms, but some people have had to be hospitalized with breakthrough infection as well. And we do know now that they are able to transmit the infection to others, even if their symptoms are mild or they have no symptoms at all. And so that's where we've seen the return to masking come back, even if you are vaccinated, to help to further protect ourselves and people in our community, even with the vaccine on board.
You know, what I think you just alluded to kind of explains a question, that an audience question that just came through. People I hear a lot are, why not just get infected and have natural immunity as opposed to getting the vaccination?
Yeah, so this is a question that has been coming up quite commonly. We do know that for some period of time after you get natural infection, you probably have some protection. But when we look at how long that lasts, it's still not very clear. And it likely depends on the individual, on their immune system, when they were infected, a whole bunch of different factors. And so vaccine-related immunity seems to be more durable, probably last longer, seems to be a bit more specific. And so that's why even if you have had infection before, we're still recommending you get vaccinated. And we know that people who have had infection and then gotten vaccine develop really nice high antibody levels that provide them with really good protection. And so that's still the recommendation. And we're still working to understand how long even vaccine-related immunity lasts. We've recently seen a recommendation for third dose of vaccine, initially for immunocompromised patients or patients with weakened immune systems, and now probably more generally in the population starting later on this fall. And so definitely we know that the vaccine is the most highly protective for serious illness and hospitalization from this infection. And so very much recommended for anyone over 12 years of age.
Great, thank you. All right, Dr. Levy, I think there's been a lot of questions about the Delta virus or the Delta strain. Has there been a change in the mode of transmission compared to earlier strains of COVID-19 that were circulating last year?
Yeah, that's a great question. So coronaviruses of all types are thought to have similar types of transmission, and that includes community coronaviruses that we saw before SARS-CoV-2, as well as all of the strains or variants of SARS-CoV-2. That transmission in infection control speak is also often called droplet transmission. But what that means is that the droplets hang in the air and you can breathe them. So the transmission is the same. It's different sizes, many sizes of infectious particles that are in the air that people are breathing in. And that transmission has been what we've seen from much of the evidence throughout the pandemic, as well as evidence before the pandemic for respiratory illnesses sustained across all types of coronaviruses.
Okay, that's really helpful. Thank you. So now we've really got kind of a baseline knowledge about where we're at with the Delta variant spread across the United States. Let's move on to shifting talking about children going back to school. So, Mr. Schroeder, do you have any questions or any, excuse me, suggestions for parents to really help their child adjust to school, especially during the time of COVID-19? We're still kind of in the situation pandemic that we were in last year, but we're starting at the beginning of a school year when a surge is occurring.
Yeah, thank you, Dr. Mattke. First of all, thank you for allowing me to be a part of this very important discussion. By all means, I don't have all the answers, but only suggestions from a school perspective.
Mm-hmm.
I'm one of many administrators in Rochester, but as a principal of Washington, I'd be happy to share some insights with you. But it may sound so simple, but practice is probably the biggest thing that I can think of. Practice waking up at the time you normally would for a typical school day, run through the routines and take a visit to the school if possible, walk around the school of the building, and have conversations with your child about what to potentially expect. The thing that's probably the scariest for kids is the unknown, right? I mean,
Mm-hmm.
the unknown of this virus, the unknown of what's going to happen and the predictability of that. And so if we can help alleviate some of that unpredictability and unknown events, the better students will be in adjusting back to school routines in both at home and at school.
Absolutely. There's a small subset of children who have been experiencing higher levels of anxiety at school in general, or developing school anxiety, or even school refusal as they return to school, especially if they were previously in a distance learning model. What can parents do to support these children that may have higher levels of anxiety going back to school in an in-person setting?
Yeah, that's a great question and an extremely valid concern by many, and I hear it on a daily basis. But if I could, I'd like to place a link into the chat and just kind of briefly talk a little bit about this resource that might be available to families. Let me see here. Did you see the link in there?
Haven't seen it yet, but I can share it on the screen if you
Okay.
keep talking about it.
Yeah, I'd like to, the link that I just placed in there potentially could be a good resource to families who may need some additional assistance in this area. But for me, these meets were great reminders for not only the students that we serve in our building, but my own children as well.
Mm-hmm.
Last year, the Rochester Public School organized monthly Google Meets with families from all schools to provide relevant and easy things to implement, ideas that assist students through these very challenging times. The folks that led these monthly meetings were either experts from within our school district or our community partners. Most of the elementary, that's a great resource to look through and peruse for families to watch these recordings that happened last year. But the second thing that I wanted to just highlight too is most of our elementary schools within Rochester have implemented what's called Steps into Learning. What this is, for those unfamiliar to Rochester, we designate the first 2 days of the school year to face-to-face, and if families want, virtual option 2 as well, but a 30-minute conference with the family and their classroom teacher. This is a great time to meet, discuss expectations, share any concerns that may impact their child's social, emotional well-being, and for that matter, develop any plans for the start of the school year. And if time allows, teachers may administer some short assessments while parents complete the paperwork so that teachers can then get a jump start on where their students are academically. But it also just gives an opportunity for families and kids to be in the building before the start of the school day. Sometimes, it's not just the kids that have that anxiety, it's some of the family members that do too, that they're sending their kid to a building maybe that they haven't been in ever, or that they haven't been in for a year and a half to 2 years. And so this is a great way, and the Steps into Learning is something that we had prior to COVID, but it's kind of been a blessing in disguise to now have this in place for most of our kids and most of our buildings, to kind of ease that transition back into school, to lessen that anxiety for both our kids and for our staff, as well as our family members too.
Excellent. And we will also share this link in our Facebook link, so families can access that after the show, because there's really valuable information in these webinars that were done. All right, so Dr. Levy, question for you. So now we're talking about kids back in schools. Should children and school staff, would masking be a benefit for them regardless of their vaccination status, or should just children and staff who aren't vaccinated be masking?
Yeah, Great question. As Dr. Rajapakse said earlier, we're unfortunately seeing infection and transmission of SARS-CoV-2 or COVID-19, even from vaccinated or asymptomatic patients at this point. And so although vaccination remains protective against severe disease and hospitalization and is highly protective against those things, we're seeing that it's not protective against transmission. So that is, you can have a child who's asymptomatic, doesn't even know they have COVID-19 and is well themselves, who could still transmit COVID-19 to another child. And so both real world experience and scientific studies have shown that universal masking reduces transmission. And at this time, the CDC is recommending masking of children over age 2 indoors.
Excellent. You know, a lot of families have had questions about what type of masks are protective and which ones they should be using. There's been some questions about, are cloth masks protective only for a certain time, or should children be looking at things like the KN95 masks?
Yeah, those are good questions and reasonable for folks who are concerned in trying to protect their child. There is a great resource on the CDC about face coverings, recommending when to wash face coverings and the most appropriate face coverings. So I'd recommend folks take a look at that. But in general, we recommend a double layered mask. So that could be a cloth double layered mask or a medical grade mask that's child size. Most medical grade masks have double layers. KN95s or N95s are a type of mask that removes particles from the air and that are sometimes called respirators. They filter out very, very small particles from the air. And N95s are designed for healthcare workers. They've never been tested for safety in children or smaller size faces, and they also haven't been fit tested in children, which is a term that healthcare workers use for testing the fit of N95s and whether it seals safely and effectively around the face. And N95s are not required for healthcare workers caring for COVID-19 patients. So I myself take care of patients in the hospital with COVID-19 wearing what one would term a simple or surgical medical mask. So at this time, there's no evidence that children in school would require an N95. And we also don't know if N95s are safe, especially for smaller children with smaller facial structures.
Excellent. How about when should children be wearing masks in school? Do they need to wear them just indoors, outdoors, both, or are we still kind of getting more information on this?
Yeah, so in general, the CDC recommends universal masking indoors for folks who are over 2 years old, as I mentioned before. This is part of a strategy called layering, which involves protecting against transmission through multiple ways. And those ways are things like social distancing, vaccinating everyone who can be vaccinated, ensuring really good ventilation, contact tracing. So outdoors, you have often that layer of social distancing and ventilation. And in that setting, it's less important for folks to mask to prevent transmission.
Excellent. Mr. Schroeder, there has been a lot of concerns among parents about wearing masks, especially at the start of COVID-19 when kids were returning to in-person school. Can you tell us a little bit about your experience? How did you feel that the kids did at your school wearing masks? And did some kids really struggle with this, or did the majority of kids do pretty well?
Yeah, to be extremely honest, the students I witnessed last year and a half were fantastic.
Okay.
Students were very responsible and resilient in wearing masks. Yes, there's at times where we have to remind students, at times to pull them up to cover both their nose and their mouth. But
Right.
all students understood and were very respectful in following that expectation. I believe as adults, we can help decide how students will react with mask wearing by our own actions and comments around the topic. Students feed off of the adult energy that is around them. So if we can remain positive and students, tend to fall in line with that. And to be honest, yes, I've had conversations with students about mask wearing, and at times I've said to students, geez, wearing these masks can be bothersome, uncomfortable, or annoying at times, but if we all do our part, we can keep ourselves and other people safe, and most importantly, in school with our kids.
Yeah, really creating that sense of community it seems to be really effective with children. They know they all have their role and they're all working together for a common goal and a common good to keep everyone healthy seems to be a really good message. And I know that you've done that in your school as well. Do you have any tips for parents of other things that they can do to help prepare their child to wear that mask during the school day and what it might look like if there will be break times for them to take the mask off?
Yeah, the thing that I would suggest to parents is focus on what we know and what we can control. Spend time listening to what they're excited about, what makes them nervous, provide reassurance that that we will get through this together. I think the last, family session in that link that I sent really talks a little bit about ways that you can build routines. I think it was the title of that session was called Critical Routines and Child-Centered Connections. That link that I was shared would be beneficial to those families interested in supporting their children and coming back to school.
Excellent. Yeah, routines are so vital. And when kids don't know what to expect, that's when we see anxiety increasing and the fear of the unknown. So if they have a routine and they know what to expect, that we really see that come down. And it's normal for all kids to be a little excited and a little bit nervous, maybe on that first couple days of school. Is that what you tend to see in the school setting as well?
Yeah, absolutely. I mean, the nervous thing, and to be honest with you, adults have that too. Staff, even if it's in your, first, fifth, 10th, 25th year, you always get that kind of butterfly feeling in your stomach about that. But I think the more we can have conversations, the more we can, reassure kids, the better they will be. And I think just practicing it, and you mentioned about the breaks with the masks. As of right now, currently, in our district, we have where students will be wearing masks in buildings and on transportation. As of right now, outside when they're at recess, they won't have to wear it because they're outside. But again, that could change, in a moment's notice too as well.
Okay, thank you.
Mhm.
So, Dr. Rajapakse, Dr. Levy had talked about like different levels of layering to kind of help protect children in the school setting and help protect adults even as well. One of those level or modes of layering would be including cleaning of surfaces and hand washing to really help prevent the spread of COVID-19. This was something that was talked a lot about in the beginning, and people were even like sanitizing food they bought and things. Is that something that we should still be concerned about, or is this less likely a mode of transmission of COVID-19 Delta variant?
Yeah, so transmission from surfaces is not a major way that COVID-19 is spread from person to person. It is theoretically possible. And so that's why we recommend hand washing as one of the layered preventative strategies. The really important thing to recognize, though, is that hand washing prevents so many different types of infections. So while we're spending a lot of time talking about COVID-19 today, there's lots of other respiratory viruses or stomach flu viruses that circulate in schools and childcare settings, and hand washing is one of the best things you can do to prevent many of those as well. So definitely in combination with all these other measures, a really important one to remember, and especially for kids to make sure that they understand how to do it properly, that they have to wash their hands for 20 to 30 seconds, and making sure that they have easily accessible facilities to wash their hands, or at least easy access to things like hand sanitizer, and understand when the times are that they need to use those, because it'll help with COVID-19, but also with lots of other different types of infections and spread of infections in the school setting.
Absolutely. We have a great audience question. I want to start with Mr. Schroeder answering this, and Dr. Levy and Dr. Rajapakse, please chime in if you have anything else to add. Among children who have special healthcare needs, tolerating a mask or a face covering may be challenging for them. And this audience member is wondering if you have any guidance to help really build up the tolerance for children to be able to tolerate these face coverings and masks.
Yeah, that's a great question. And in our building, we have a couple programs where we have some intensive programs that have kids that have some difficulties doing that. But the more that we practice and the more that we kind of, I'm going to come back to that practice theme of when we talk to families, if you can practice wearing that and building up that, building up the ability to wear those masks at long periods of time, I think is probably going to help. Obviously, they don't have to wear it the entire day because there's breaks throughout the day that they're going to be able to have. And if we can talk to them and communicate with them about when those breaks are, the more positive they are about wearing those masks. So I think the biggest thing for parents is to practice before, putting that mask on, get comfortable with the masks that kids feel that are the most beneficial to them. I think will help them in the end.
Mm-hmm. Some school districts across the United States have already started school. So many school districts will still be starting. So there's still time where they can start practicing. Would you recommend like a couple minutes a day start and then kind of building their way up to longer periods of time? I've seen some examples of this on the internet for families with children with special healthcare needs.
Yeah, I think the tolerance, building up that tolerance over a period of time is obviously beneficial. I mean, we're down to the countdown here with, a little over 2 weeks left, but I think there's still plenty of time that you can build it up every single day and talk about, a plan of when you can take it off and when you can't and build that tolerance up.
Okay. Great.
Dr. Mattke, I would agree. And I would add that one of the things that we emphasize for kids wearing masks is that they do need to be able to safely take it off. So for children with neurodevelopmental disabilities, there may be other strategies that should be employed for that kind of layering if they're not able to take their mask off. But it can be hard for all children to learn how to wear kind of these simple double layer masks. And so that's why it's likely most effective and safe to emphasize consistent and correct masking with a regular mask that has double layers, practicing covering both the nose and the mouth with something that's consistent over time, rather than kind of trying out a variety of different types of masks and methods.
Yeah, and I was gonna also add, I know everyone is excited about their brand new first day back to school outfits, but I wouldn't recommend a brand new first day back to school mask. I would use something that they have worn before, are comfortable wearing, and that they can tolerate keeping on for as long as they need to.
I love that recommendation. We are getting lots of audience questions, so I just want to make sure that we're covering those. What about for children who are less than age 2 and are unable to mask safely? Is there any strategies that you would recommend to really help reduce their risk of transmission?
So I think for the age group under age 2 that can't mask, this is where things like distancing comes into play, especially. So if trying to keep them away from obviously anyone who is obviously ill or unmasked, and depending on that physical distance over which droplets don't often travel very well, can be additionally protective for that age group. I know in some settings, for example, if a baby's in a car seat and you drape something over the car seat to act as a barrier, that can be helpful, especially if you're going into healthcare settings or something like that. But distancing is really what comes into play for that age group.
Absolutely, I would agree. And this is still a layering technique for those around the child as well. So this is where it becomes really important for the adults caring for the child to be vaccinated and to be following the other layering strategies when they're out in the community with the child or when they're not out in the community. Obviously, we don't recommend that parents are distancing from their own child, but I'm talking about taking those methods when they're out away from the child to when they come back, be less likely to transmit SARS-CoV-2. And for caregivers for children under 2, this is where it's important that they're also kind of using those layering strategies, including vaccination and masking themselves.
Excellent. Mr. Schroeder, I have a question for you. How do you recommend that parents that want to help support the school personnel and teachers do that? Should they reach out to their schools, or are there other methods that you would recommend that they approach this?
As far as masking, or
just partnering with their schools during COVID-19, is there any things that you feel that teachers and school staff really need to help support them?
Yeah, no, I just think asking questions, being in contact with their classroom teacher, and just remember to love I know this sounds simple, but love your children unconditionally. I know there's a lot of things that this pandemic has taught us, but it really has taught us to focus on the priorities of, relationships with students to students, students to adults, and adults to adults, given the fact that we have to still, continue to social distance, which is still a difficult thing to do in schools. But I think that if we can just focus on the individual and continue to have those conversations and listen to your children, and kids have a lot to say, and they can give us a unique perspective. So if we just sit and listen and love them conditionally, I think you'll learn a lot.
Excellent. We have lots of questions about COVID transmission in schools and what to do if they develop symptoms. So let's go through a couple of those. What are the recommendations during lunchtime for kids? How far should they be distanced when their masks are off when they're eating?
Is that question for me? Or
For
is that-
you, yeah. What are you guys going to be doing in your schools? And then
Yeah.
Dr. Levy and Dr. Rajapakse, if you guys have anything to add.
I think our recommendation that we've seen is, obviously the at least 3 feet of distance, especially when they're unmasked and they're eating and not facing face to face. If they have to be, facing in all the same direction, that's probably the best. But what we've seen too is also some unique opportunities where we can face kind of in a W style where they're kind of off-centered from one another to create more space in our areas for kids to eat. But again, one of the recommendations is at least 3 feet away and facing the same direction.
Will the eating outside, is that a possibility? That's something that will be pursued, do you think, in schools?
Yeah, I mean, there's schools in our district that have gone to the point where they've fundraised to have picnic tables positioned all around their buildings so that they have kids and adults that are eating outside. And we tend to do that too, as well as, in the state of Minnesota, sometimes you never know when you can eat outside, and obviously in November, December, January, and February, and that tends to not really be the case. But obviously our falls and springs are great times in Minnesota, and we can take advantage of that eating outside too as well.
Fantastic.
Yeah, I would completely agree. Another, strategy that some are employing is cohorting. So having the same children eat together every day. It's a little sad in terms of kids getting to social network with other kids, but we know that if you're unmasked around the same smaller group of people, there's less likely to be transmissions between those small groups. So some schools are using that method as well.
Fantastic. So a lot of questions coming in about need for testing for COVID-19. I know there's been some districts, some states that have recommended an approach of asymptomatic testing of children. Is that, can one of you guys talk a little bit more about that and what that would entail?
Dr. Rajapakse, do you want me to take that one?
Sure.
So frequent asymptomatic testing is one method that's been employed successfully in some settings throughout the pandemic, both by other countries as well as by settings like healthcare settings where asymptomatic patients are tested either before a procedure or if they're admitted to the hospital for another reason, still tested for screening. Because of the transmission of SARS-CoV-2 and how quickly one can become infected, it needs to be very frequent. So you can't test someone 1 week and then 3 weeks later assume they still don't have SARS-CoV-2. The most effective testing is anywhere between 2 or every 7 days for kind of repeated testing and looking at repeated exposures. And so the burden on communities has been relatively great in terms of both the cost, getting the test turned around, and then actually the testing on the individual. And at this time, most experts are not recommending repeated, every 2 or every 7 day testing for school children, because we've seen quite a bit of real world evidence as well as scientific evidence that if we employ those other layering strategies, children can go back to school safely with masking and with vaccinating and with the other layering strategies that we know work.
That's very helpful. I think a lot of parents are kind of waiting for when they maybe would get a phone call or an email saying that their child had been exposed at school. What does this generally look like? And would children need to be tested or quarantined before they would go back? And I know that there may be some variations among states about what the practice is for this, but can you kind of elaborate on the general approach recommended by the CDC?
Yeah, so it is certainly possible with return to school that there will be cases in classroom. We know that in communities where there's a lot of spread in the community that we do see cases in school. Thankfully, schools don't seem to drive kind of what is happening in the community. And so certainly, yes, schools are expected to have a plan in place for how they would notify families if there were to be an exposure in the classroom. And I would encourage people to be familiar with what is recommended by their local public health officials, because there will be some variability. Certainly, if a child is exposed, if they have symptoms, for sure, they should be staying home and getting tested. As I talked about earlier, there are other respiratory viruses circulating. We're also going to be getting into flu season come fall and winter. And so it's impossible to look at a child to know whether they have COVID-19 or do they have some other respiratory virus. And that's why testing is especially important if they have any symptoms, and they should not be returning to school if they have symptoms. The recommendations on return to school kind of vary. Generally, before they return, if they were having symptoms, we want them to either have a negative test and resolution of their symptoms in most situations. For exposure, there's what we call an incubation period for this infection. And so people can develop symptoms anywhere, generally from 2 to 14 days after exposure. And so that's kind of the highest risk period of time. We see most people who are going to develop symptoms or test positive within kind of 3 to 5 days of when the exposure occurred. And so there's some places that are recommending testing kind of during that period of time before deciding if someone can return to school safely or not.
Excellent. Now we've reached the end of our time, but do any of you have any parting thoughts that you'd like to share before we wrap it up for today?
Yeah, I can start. We know kids under 12 are not yet eligible for COVID-19 vaccination, but we have seen them fall behind on their other routine childhood immunizations. And so I would really encourage parents to talk to their primary care provider and make sure that their child is up to date on all their other routine vaccinations before they're looking at returning back to school, because there are concerns that vaccination for other vaccine preventable illnesses like measles and whooping cough have fallen far enough that we're at risk of having outbreaks of those infections happen as well as we get kids mixing back together. So please do reach out to your primary care provider and make sure your child is up to date on all the other vaccines.
I think for me, Dr. Levy mentioned it a couple times, but multiple ways to multiple layers of mitigation. I think about it as a layers of Swiss cheese, where the COVID-19 can kind of get through, but if you have multiple ways of social distancing, masking, obviously, under the age of 12, they don't have the ability yet to get vaccinated, but that would be another mitigation strategy. So I think we're going to try and do the best that we can. And I think that families will too as well, to try and, layer on top of layer of the different mitigation strategies so that we can keep our kids in school. Because I think the thing that we saw last year is that everybody wants our kids back in school as much as possible, socially, emotionally, and academically. So I think that multiple layers would be the best thing that I could probably recommend.
Yeah, I would agree. I don't have much more to add to that. We know that it's very good and beneficial for child welfare for children to be in school. And the best way we know as medical professionals to keep them in school is these multiple ways of layering that will reduce transmission, both to children as well as to our larger communities. And so encourage everybody to get your facts from reliable sources and continue to educate yourselves, and go to your pediatrician or other trusted medical professionals if you have questions.
That's great. And I just want to echo on back of Dr. Rajapakse's comments. Influenza vaccinations are going to be starting soon. I know in Rochester, we're very busy planning our immunization influenza school-based program. So make sure that you are talking to your healthcare provider and getting your child's influenza vaccination up to date for the coming year, because it may not be as mild of influenza year as we've had in past. And this is just another way to help protect your child and keep them in school. Thank you guys. Thank you everyone so much for joining us today. Mr. Schroeder, thanks for taking the time away from school and planning for the kids to return.
You bet. My pleasure.
Dr. Rajapakse and Dr. Levy, thank you again for coming back. You guys are always fantastic at providing the latest evidence and guidelines for families.
Thanks for having us.
And thanks everyone who joined. You can catch the next Mayo Clinic Ask the Mayo Mom on August 26th at 11 a.m. Central Standard Time. We're going to be discussing running injuries in youth athletes with pediatric sports medicine physicians, Dr. David Soma and Dr. Luke Radel. We'll also be joined by sports physician or physical therapist, Stephanie Lopez. So be sure to catch that edition. Thank you, everyone. Remember to stay safe, get vaccinated, and have a wonderful day.